Hello and welcome. I'm Michelle Abad and you're watching Rappler Talk. As the nation faces the coronavirus pandemic, millions of poor Filipinos are left to keep themselves fed as lockdowns have kept many out of work. The Department of Social Welfare and Development leads the implementation of the Emergency Subsidy Program, or the ESP, to cater to 18 million poor and vulnerable families. However, dozens of problems have arisen in its implementation, such as reports of families in need wondering why they haven't been included. Joining me today virtually is Dinky Soliman, former DSWD secretary, and today we will be talking about the implementation of the ESP so far and how can it be improved for the month of May. So hello and welcome, Ma'am Dinky.
Hello, Michelle, and good day to your televiewers and listeners.
Okay, so we're nearing the end of April as we're recording this. So how would you generally assess the implementation of the emergency subsidy program so far at its halfway mark?
I think, yes. First of all, I think it is fraught with challenges. Right now, even as we speak, the assessment of the SWD and the local government units is that in the National Capital Region, it has really been slow and fraught with a lot of missteps. What are the missteps? I think the first misstep was the announcement of the higher authorities, the legislators, that this will be given to all 18 million people, and they gave an amount which is 8,000 pesos for NCR. And so everyone in NCR who think and believe they are poor are expecting this. So the first misstep is this kind of unclear communication because it made expectations rise. So when they were starting to implement, the first issue was who are going to be given, who are the 18 million. I am an 18 million person because I lost my job. I'm an 18 million person because I don't have anything. I have no income now. So that has become, I think, the first challenge. And when they started giving out the criteria and started giving the types of people who would get senior citizens, PWD, solo parents, they were not clear that it was going to be families and not individuals. So that was the second misstep. And then the third, and this is up to now the main issue, is the list. Because the LGU are claiming their list have more poor people than the amount allotted to the LGU in particular. So it would be something like, I am the mayor of X city. I know that my poor constituents number to 100,000. My allocation is only 60,000 for 60,000 people. Where do I get the 40,000? That where do I get the money where I can give for the 40,000? So this I think are the three main challenges. And as far as I understand it from our engagement with discussions with government and our monitoring, they're trying to correct this now by having a clear guideline on how the LGUs will identify the uh, low-income families. And they are now trying to do two things. List the families and at the same time ensure, because there was a new um, guideline that says to make sure that the people who receive support from DOLE and DTI do not get support from DSWD. So that complicates it even more. So I really think that in a situation like a disaster, because the pandemic is a disaster, there is need to just go ahead and err on the side of distribution of what people need. There are actually regulations with COA that you can use for emergency procurement, emergency disbursement. We used to have the emergency cash transfer for all victims of disaster. They could take a look at that. My point is, it's already the end of April this week. And if you only have, as far as our monitoring goes, in NCR, 1 to 3% disbursement at the level of the LGU, that means people have not received the money at this point. It means DSWD had given the money to the regional offices. The regional offices of DSWD have downloaded it to the local government unit. But from the local government unit to the people, that's where the knot is. Dun na babara. And the reason for the bara, bakit hindi lumalabas yung pera, is because of this list. And this list, I think, is the most complicated process because of all the rules that they have put in. If they can just simplify it and just say, put out the National Household Targeting System list, all those who are not under Pantawid, put that list into the LGU, identify where they are, and give it to them because they have been validated as people in need. That they have gone through a validation process in the National Household Targeting System. And whoever is left that the LGU feels still is in need and should be supported, that's where they negotiate for additional funds from the national government. Because even the national government people, from the president himself and the IATF, is saying that if there are people who are falling through the cracks, they can complain and they can ask for additional support, additional funds. But I have read, I think yesterday or the day before, Secretary Bautista saying that the funds are getting low. Now, that to me is the other issue. I really think, with all due respect to all our national offices and national leaders, collaboration is really the key. If there's any lesson I have learned in our work with disaster response during our time in DSWD, what really helped, given all the problems we faced, we were able to, I think, address. It helped that we were collaborating with one another, meaning the national government agencies and the local government units really sitting down and planning a step-by-step operational plan of what to do to be able to address the needs of the people, because no one agency can do the work, no one leader can do the work. It has to be a collaborative effort of everyone. And most important for me, Michelle, is it's a collaborative effort between the citizens and the government. So it is important that we encourage feedback. I remember when I was in Tacloban during the time of Yolanda, people would call me up. I mean, my phone was literally available for everyone. But even journalists would tell me, "Mom, I came from this place. They had nothing. Please make sure." In other words, you just have to be open to feedback of citizens. Check, validate, and respond, because the ones that can really tell you what is going on the ground and you can respond to them is are the people themselves, and they can help. They're not helpless people just waiting to be given. They can be the ones to distribute. They can be the ones to tell you how to do it. They can even help you in the listing. In fact, I think what was one of the more important things that helped us before was that we always provided the list publicly. So that means in a barangay, they know who is in the National Household Targeting System. That's a public, we put it out in an assembly so that they can say, wait, you forgot this person or this family, or they can tell us, why is that family there? That family has 2 OFWs already working abroad and they are getting subsidy from them. Maybe they should not be in that list. You see, because the ones that really know the situation on the ground are the people themselves. And while there will be outliers of abuse or, stories of lolokohin ka ng tao, by and large, people know how to help one another. It is not the common thing of getting one over. Hindi man loloko ang Pilipino. Meron, pero hindi yan ang general sentiment ng tao. Lalo na sa panahon ng disaster, I have seen people who already are poor can still share whatever they have to their neighbor who have nothing. And I see that also today when we do the distribution, because I was sharing with you earlier, I'm part of the Bayanihan Musikahan that is giving out food packs from the funds raised. Whatever we're able to give to a community, if it is not enough for those whom they think the vulnerable people were not included in the list because we also work on the list, they would divide up whatever they have so that they can share it. It's natural for us in a disaster to share more than to be selfish. So that I think is my important message to our national leaders: collaboration, and collaborate between and among yourselves, but collaborate with citizens. The citizens know what they want, and they can help you implement all these programs in a way that's more responsive to their needs.
Mm. Okay. So the process indicates, according to the guidelines that the DSWD put out, that when the DSWD turns over the funds to the local government, it is up to the LGU to come up with a distribution scheme and also come up with the list of beneficiaries, like you were talking about earlier. So with this system, do you think it's a good system, or if not, what are the risks in it?
The risk, with all due respect to our local government unit officials, there is always a risk of politicizing the list. This is the reason why we have a national household targeting system, which is done by a national government agency that goes through proxy indicators of poverty and does a survey of, the last survey I know was done in 2017, if I'm not mistaken, and they have more than 80 million household data points that look at the situation from a proxy indicators of poverty. Why is that important? Because it is an objective, evidence-based assessment of the situation of a family that can be considered poor or non-poor. If you put it with the local government unit, even if they do not politicize it, the perception of people will always be it is a politicized process. Uh, and unfortunately, our political system lends itself to that because the LGU will work with their barangay council person, and the barangay council person will be the one to say, okay, you give this to this person or family, that one he did support us in the last election, maybe not give, or if you give only one half. That's the risk. In development language, it's called elite capture. The resource is actually provided for those who support you during election, and that is also in a way a burden for the local official because you are blamed even if you did not do it that way. So I really think that if I had my if we could redo this, the listing should really come from an evidence-based list like the National Household Targeting System and remove the decision from the LGU because the LGU that's why they are not releasing the money right now because they know that they are going to be blamed because what is being said publicly by the national leaders is the LGU is the one making a decision on who gets the money or who don't get the money. And that doesn't go well for a politician who wants to be elected again because there will always be people who will feel you chose him against me because I am not your friend. So it becomes very difficult for them, I think, at this point. So that's the risk for having the LGUs identify um, the uh, beneficiaries. Our political system is still young, uh, not not a very robust democratic process that people believe in. We still are working on a patronage politics system. So we're trying to remove that by having a list that is evidence-based that's done by a national government agency. So that would have been what I would have wanted to do uh, as a first step in identifying the beneficiaries.
Can you actually tell me more about this national household targeting system? Did I get that right? No, because
Yes.
but that's the explanation from the DSWD now, that the 18 million was largely based on the listahanan, or the database where they keep those families.
Yeah.
But then, like you said, the number of families that are actually in need don't actually jibe with this listahanan or this database. So how could this have happened? And is it in the process of listahanan, or where does the problem lie?
Two things. Now, first, well, how is listahanan undertaken? Listahanan is undertaken through a national survey that's done on a house-to-house basis, different from a census. The census is also done on a house-to-house basis, but it does not cover all of the poor areas, and it cannot be used as a targeting system because of privacy laws. But the National Household Targeting System is designed and is told to the people when they do the survey that this is going to be used for targeting. And there are what we call proxy indicators. So we do not ask directly what is your income, but it is looking at the make of your house, where you live, how do you have, what is inside your house. Is it made out of cement? It is. Do you have a roof? What is the community around? Is there water? Do you have toilets? In other words, these are proxy indicators, as they call it, for poverty. And then you put weights. We have worked with this national household targeting system with economic and statisticians. And actually, the one who has helped us design this last one is the head of the Philippine Statistics Authority right now, Dr. Dennis Mapa, who was then the head of UP Statistics. So in other words, it's a robust system of having evidence-based indicators that will tell us if a person is poor or non-poor. And we have added a third category of near poor. What does that mean? That there is a poverty line. If this poverty line you fall under, you are poor. If you are above the poverty line, you are non-poor. But if it is between 1,000 to, I think, 10,000 pesos up, you are near poor. Because if a sudden sickness, a pandemic, a disaster happens, you fall down again. So that is the basis of the National Household Targeting System. So now, what is the problem? Why is it that they are saying, the LGU, that their numbers do not match with the National Household Targeting System? My understanding is that they've only started to look at the National Household Targeting System in the last 2 weeks or so. Before that, they were not talking about the National Household Targeting System. So the tendency now is to take a look at that, and I think the first thing to do is really go down, and in every city the list is in a computer, so it's easy to run, and you can run that with the uh, list of names of the LGU and see if they match, and those that fall are the ones that you validate if you can still include them in the list of those in need. Part of the problem really is that when we are in a pandemic, at the time when the system when the survey was being done, which I understand was done in 2017, we did not have a pandemic. So today, those who felt and those who answered that they were not part of the poor are most likely either near poor or poor already, because they have not taken any income for a month and a half. So that's where I think the problem lies. Because if you ask people right now, are they poor? They will all say we are poor because we have not been earning anything for a month and a half. And even if I was a near poor at that time or a non-poor, today I am a poor because of my situation. Objectively, it's not even uh, a perception. I truly do not eat 3 times a day. I truly do not get my income, which I used to get every day. So that I think is part of the challenge, Michelle. That's why there's the LGU is saying we cannot just rely on the NHTSPR now. But I think it's a starting point, and that's what I meant by having a more collaborative approach. Look at this as a problem-solving situation, and just go through the steps of identifying from the list of the NHTSPR, and then give it out so that people will be able to calm down, that help is in fact within reach, that it's not going to be. And if you have a complaint, and this is part of what I saw was a good thing, I monitored that yesterday in a webinar that I heard occurred with DSWD. um, they already have, and I also heard that in another show where they said they can actually call, and there's a grievance mechanism that is already in place, which means people can call this number and they can complain, and action will be taken by DSWD. That I think is very important, because if people know where they can go and say the problem and expect an action, that really brings down the loss of confidence and increases the trust that something will be done, because I have talked with someone from DSWD who knows the problem and will be attending to the problem that I actually articulated to them.
It's interesting that you brought up how poverty can be dynamic, because like this latest list from the National Household Targeting System is way back in 2015. And let's say all of those families way back in 2015 are still poor today, but then more were added to the number just because of this pandemic, because maybe when they were earning before this pandemic, they didn't really consider themselves poor. But now that they're not that they're, say, in setups that are no work no pay, they now consider themselves poor. So there are probably many cases of that emerged, no, which is where the LGUs probably had problems in identifying the list that they would give to the DSWD. So
Exactly,
mm-mm,
exactly, Michelle. It
mm,
makes that even more complicated.
mm. So if you were DSWD secretary today, how would you have done and maintained the program?
First of all, I think I am very grateful that I am not the secretary of DSWD today.
Mm,
And really, really, my sympathy and my admiration to my former colleagues I really feel for them. I really do. I've worked with them, and they're one of the best uh, government employees I know. They really are service oriented, and most of the people there have been there for the last 20, 30 years, just continuing to serve. And I really feel for them at this stage, because I think they've been caught in the middle of the missteps. In other words, if the civil servants had been given the chance to be heard, I think they would have given the wisdom of what disaster response had been doing for so many years. So if I were there, I would really do three things. I would make sure that collaboration between and among agencies are happening. We need to talk to one another. We cannot not talk with one another, and 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 uh, work together. The Department of Health, the DILG, the SWD, because if we don't work together and mobilize the resources that we have together in a strategic way, it really will take time, and our resources get depleted very quickly. The second is I would really start with the National Household Targeting System, and work with each LGU to define, okay, this is where we are. How many more would you need? Let us go through a validation process. And the mobilization of the people would really be through the City Social Welfare and Development Office, our city links and municipal links. And the only thing that I would make sure of is that they are also provided PPEs, because they will be exposing themselves into the community. So provide them the mask, provide them the face shields and the gloves, because the way to be able to really deliver the service is to be at the community, and that would be where I would be doing the work. And third, that we would be in full force. I mean, I know it's a pandemic, but social distancing is important. So we need to do all of the protocols so that we will not get sick, but that you have to be felt by the people. And that to me is the most important thing, that you're able to communicate, that you're doing something, that it is with compassion. Alam mo, kamay kalinga. Talagang what is important is at this stage where fear is so prevalent, is so evident because you don't know what this virus is. The support I think that people would need is a feeling of things are going to be addressed, my problem will be addressed, and that there is some care that's going to go into my need. So it's really calming the fear, and the way to calm the fear is to make sure that you're communicating well what's going to happen, what you're communicating, the support that's going to be given, and that you're communicating it in a compassionate way. That I think is very important.
It's very interesting. You also pointed out how, since this is not just any kind of subsidy program like in typhoons or other disasters where the manpower can just go as they please, but this is a pandemic. So there are also reports of social workers that are getting sick. So we also need to make sure that our social workers are also well and protected. And this also sends a message to the beneficiaries, I guess, that they're in good hands and they're also being cared for by their social workers. No.
Yeah, that's very true. And I really think that that's part of what we need to be conscious about, that the social workers, the people who work in the Department of Social Welfare and Development need to also be protected because they get exposed. And if they do get exposed and you start getting people sick, that really is not going to help. And secondly, part of the being there with the people and being able to really work with them is also communicating that, okay, we're in this together. Let's do the social distancing. Let's do the protocol. Part of the information and education campaign is really demonstrating how it's done. And demonstrating how it's done with your PPEs will really make the people see, so that's what they mean.
So you talked about, ma'am, how you would do it if you were secretary. But going back to the current system, what are your recommendations for the implementation of the emergency subsidy program moving forward for the month of May? What do you think of the recent presidential pronouncement that only families under enhanced community quarantine will receive subsidies for the next month?
First of all, I think moving forward, let's not keep changing the rules. Because the people at the level of implementation, which is at the barangay and at the local government unit, they will get confused every time you have a pronouncement that, like what has just been pronounced, only those in the ECQ. What about those that had a month and a half of no income, who are expecting to be getting something from the government because that was what was said in the beginning? So I don't think that you should be changing rules. That's the first. Second, I would suggest that we continue to work on the 18 million list and provide for everyone who qualify under the 18 million people list, because people are expecting, and that is something that they really need, because based on what DSWD listing had said and the LGUs, people are without income and therefore are on the verge of food insecurity. So we really need to give them the support. Uh, and then third, moving forward, I would think that um, I would move faster in the release of what is due the people and release it already. And this is the first month that they should have been given 8,000, 5,000, whatever is the amount, for the 13 million low-income families who are not part of the Pantawid listing, they should just go ahead and give it. And how will they do that? Again, I think they should either help do the local government unit go through the list and use the National Household Targeting System as the first cut, and then those who do not fall do a validation process together with the local government unit. And I think that would increase the capacity of disbursement. And finally, when they are doing this, uh, the idea of making sure that the DOLE and the DTI support does not go to the vulnerable families that are getting money from DSWD, then I think what the three agencies should do is just do a duplicate check of their listings. If they have a list for each of them, a duplicate, there's what they, there's a program that's called a duplicate check, that you can check actually if there's a similar name, that you can remove it. Then you know now those with duplicate names are the ones that should not either get from DTI or DOLE and or DSWD. In other words, use technology also as a system. There's enough technology out there. Private sector can come in to help. You can mobilize some of the call centers to be the answering team to explain what is being done. There is technology that can help them communicate better to the public.
Okay. And very last, the pandemic is unpredictable. No, it's not like other disasters where we know when the typhoon is going to go away, or we know how much is exactly needed to rebuild houses that are affected by an earthquake. But this is a pandemic, and this can go on for months. So apart from the emergency subsidy program, what are other ways that the government can keep catering to the poor in should the state of calamity extend?
I think the first thing that should be addressed is really have a very clear strategy on addressing the health situation. In other words, let's get those testing done. Let's do a massive testing so that we would know who we should be taking care of, so that we do not have the contagion spread out. And I'm speaking about areas where it is heavily congested. We are getting reports of sicknesses coming in from the middle and the upper class, but we really have no very clear sense of how the situation is at in the urban poor communities. And I think that is something that needs to be addressed. Second, I think there should be a gradual support for reviving. Be good to think through is there are the um, microfinance institutions that are quite large and have had experience in working with micro enterprises, small and medium, because the micro enterprise and small and medium can actually start local economies to be going again. Some money can be circulating in smaller communities. That's something that I think can be looked at. What can we do? Open up the Talipapa and the Sari-Sari store network and have some of the monies that are coming in from the microfinance institution and government complement so that small economies can work together. And I think the lesson that we had in Bayanihan Musikahan, which is one of the efforts that I'm involved in, we were able to buy directly from the farmers through cooperatives the vegetables and even the fish that would have been given out or rotting had we not taken it in. And that is what we have given to the urban poor communities. And it was really a surprise to them that the food packs is not anymore just rice and canned goods. It was rice with vegetables or rice with vegetables and fish. And there's a big company, the Jolly Group of Foundation, have been given out chicken. So there are new ways of responding to this by being more creative. And I really think moving forward, we cannot forever be giving subsidies and food packs. the people have to be part of the engine of reviving economic transactions by equipping them with the wherewithal, and that's funds, to have these small economies going around in their own communities. So, in other words, we have to start thinking and planning and working together, collaborating with each other. So again, that's private sector, that's government, that's CSOs, in finding new ways of doing economic transactions with social distancing, with protocols on health, with making sure that we do not spread the contagion, but at the same time, having an economic transaction that that serves the interests of both the investor and the consumer. So those are things that I think that the government should be thinking about at this point, because again, it's hard to sustain food packs and delivery of food to everyone at this stage. We need to move from there to either cash transfers, and getting the cash transfers, getting into smaller economies, into communities.
Okay, Ma'am Dinky, thank you so much for speaking to us today and giving your thoughts on the DSWD's emergency subsidy program. And I'm sure there are many families that are hoping to see improvement in the implementation in the next wave in May. So thank you again for your time.
Thank you. Thank you for this opportunity. And I do hope we're able to move forward and improve for the sake of our country. Thank you.
Okay. So we just talked to Dinky Soliman, former DSWD secretary. Again, I'm Michelle Abad, and this has been Rappler Talk.